Good morning, everybody. I'm Peggy Brown, and I am a nurse first, and then I work for Easterseals of Colorado in their discovery programs. I'm a director for Discovery Program, which is a program for Saturday respite during the school year. And so we start up in the middle of September and we come through the middle of May. During the school year, I'm a school nurse consultant with Douglas County Schools. The standard precautions training I'm giving you is mainly based around children, but I think that anybody that you're taking care of you need to understand including the prevention services to prevent yourself from becoming ill, even if you're just taking care of, a family member or a loved one. We all can carry diseases, so I want to help keep you healthy while you're taking care of the people you care for and love. This course was designed by, it meets OSHA requirements and the pre-service and child care licensing requirements. So if any of you are interested in child care licensing, this is something that's required, and child care programs and schools for the state of Colorado. I'd like to thank the Healthy Child Care Colorado Qualistar Initiative, Children's Hospital of Colorado School Health Team, Colorado Department of Public Health and Environment, and the Colorado Department of Education. Our objectives today are to define standard precautions and to list 3 ways to control and prevent the spread and reduce your risk of contracting an infectious-borne disease. And you'll be listing the 4 steps to follow if you're exposed to an infectious disease. There is not a written test after this. Okay. So we'll be defining the standard precautions, list 3 ways to control and prevent the spread and reduce your risk of contracting an infectious disease, and list those 4 steps to follow if you're exposed to an infectious disease. In 2016, a new rule came out with the licensed child care programs in Colorado, and it is State Law 770233. All staff must complete a department-approved standard precautions training that meets current occupational safety and health administration requirements prior to working with children, and I think that this is prior to working with anyone. Why do you need to take this course? Well, standard precautions protect you and others from transmission of disease or exposure to other potentially infectious material. Standard precautions are those things that you do to protect yourself from getting in contact with somebody else's body fluids. So it's all about protecting yourself and also the children and adults in your care. Our course components are prevention and control of infectious diseases, reducing your risk, taking steps if exposed, learning scenarios, the review of exposure control plan, and the test, which I told you we're not doing. Okay. How is illness spread? Have any of you guys become ill before? Okay. So it was one of these 4 vectors. In number 1, you have the blood or other potential infectious materials, and direct contact or touching, airborne, and the fecal-oral route. The only way you can catch is through other potentially infectious materials or blood is the best way to think about where are those illnesses coming from. Blood and body fluid. There's always a little red symbol at the top when they want you to think about blood and body fluid within this presentation. There are 3 microorganisms that can cause serious illness and death. These tiny organisms can be transmitted through blood or other potentially infectious materials directly to you through your mucous membranes, or such as your mouth, nose, sinuses, eyes, and through a cut, or other broken skin, a bite that breaks the skin. So if someone bites you. One of those illnesses is hepatitis B. Hepatitis B is a blood-borne infection. It is spread through either blood-to-blood contact through cuts, sexual contact or other body fluids, and it lives a long time even if it hasn't been properly cleaned up. So if someone accidentally had a bloody nose and they happen to have hepatitis B and they had a little spot of it on the table over here and you washed it up with just a little bit of soap and water, it could still be there 96 hours later. HIV is another potentially infectious blood-borne disease, and HIV is a very fragile illness. And how much do you hear about HIV anymore? Do you think it's still there? Some of the children that I take care of and work with in the schools are like, well, what is that, Mrs. Brown? Because that's what they have to call me. And I'm just like, well, it's still there. And I said, when I first got out of nursing school, there was no such thing as HIV. And then I learned about it within the first 2 years it came out, and it is just as deadly. We do have better medications available to people who happen to have HIV to help them live longer and more productive lives, but it is still just as deadly. It's a more fragile virus. It is present in blood, and it is spread the same way as any other bloodborne through open cuts, other potentially infectious materials, mucous membranes, and it can be spread sexually. So you just want to be thinking about those two. And then there's hepatitis C. And hepatitis C is relatively new, but actually it isn't, because when I first got out of nursing school, it was called non-A, non-B, and they changed it to hepatitis C. So hepatitis C is something that lives, and when you're thinking about hepatitis, you're thinking about infected or inflamed liver is what the word hepatitis means. So it's anything that would cause your liver to inflame. The two most deadly things out there are hepatitis B and hepatitis C. There is no cure for hepatitis C, and there is no vaccine yet. They are working on some. There is a medical treatment right now that does put people into remission, and you might hear about that on TV through the news. So these are some ways you can think about. We have cute pictures of kids on here, but anybody with any kind of illness or disease. Self-care is a really important skill to teach children and anybody really. If they can blow their own nose, you want them to keep doing what they can do. And putting on Band-Aids, making sure that you wash wounds really well with soap and water, and anytime you're handling that, you're going to wear your own personal protective equipment, and we'll talk about that in a few minutes as well. The risk is really small of getting ill, taking care of people, especially if you're taking good body mechanics for yourself, and you're following your standard precautions, but it's still there. Your potentially infectious bloodborne pathogens are blood, fluid containing visible blood, male and female secretions, and any body fluid that can't be identified. HIV is a virus that causes AIDS and may not have symptoms for years. Spread through sexual and blood contact, no known cure, no vaccine available. Here's a nice picture of hepatitis for you. Again, it is the inflammation of the liver. The hepatitis B vaccine or virus can begin as an acute infection. Sometimes people will report being really ill after getting this, and they have a high fever. Sometimes it's more of a chronic disease and long-term liver problems. Often people would require a liver transplant later on in life if they contract hepatitis B or hepatitis C for that matter. Hepatitis B is transmitted through needle sticks from mother to fetus and through sexual contact, more contagious than HIV. So we're all worried about HIV for a while, but actually hepatitis B is much more contagious than HIV, partly because of its long life, even after you think that it's been cleaned. Some infected people may not have symptoms. There is no known cure. There is a vaccine. The vaccine came out in 1989, and I know I got one of the very first ones in the early 80s that came out, and it is a lifelong vaccine. Here in Colorado, the CDC recommends the schedules for giving the immunizations. If you happen to have the hepatitis B vaccine, you may check with your doctor to make sure that you're up to date with that. Sometimes the schedules got misread, and so one might have been given too soon, and then you might need a booster. So those are some things. And you can either just get another booster or have blood levels drawn to see if you truly are immune to hepatitis B. In hepatitis C, it can begin as an acute infection, but in some people the virus remains in the body and the person becomes chronically ill and with long-term liver problems. Many times people don't know they have hepatitis C till they go to give blood, or on a routine medical exam the doctor's like, oh, okay, and then they learn about it that way. Most common chronic bloodborne infection is most often spread through infected needles, drugs, and tattoos from mother to fetus or through sexual contact. There is no known cure and there is no vaccine available, although they do have medication out there now that is putting people into long-term remissions. Direct contact or touching. This mode of transmission occurs when you have direct contact with the body and directly touch any infected area or body fluid. And some of the diseases you can contract this way are meningitis, impetigo, conjunctivitis or pink eye, and varicella, which is chickenpox. or you can also get shingles this way. Meningitis can spread through close contact with infected person. So you might have seen some of the commercials out there right now for the meningitis B vaccine. Very important for people who are going on to college or living in close quarters with other people, just because it is a direct contact or touching thing. If someone's coming down with it, I think 10% of the population could develop a meningitis B case into meningitis. Meningitis is potentially deadly. They've got really good antibiotics against it now, but you have to recognize the symptoms, and it can go from 0 to deadly within 24 hours. So it's important to know what you're looking at. It is vaccine preventable. Babies can get the shot, and now kids in schools get it, usually in their high school years. Chicken pox. How many of you had chicken pox at some point in your life? Okay. If you are approaching 60 or 65, you might consider getting a shingles vaccine, because you had the live chicken pox when you were young. You can have those little buds along your nerve endings, and then when you encounter another illness or something that causes your own immune system to become depressed a little bit, you can develop shingles. Shingles is, if you want to think about it, sort of like leftover chicken pox. It will take over later on in your life. Usually affects us when our immune system is challenged in some way. It is a rash that is first kind of comes up like papules, almost like chicken pox, but then they kind of connect together, and it can make just a moist rash that kind of goes along, and it's usually just on one side of the body. So if I were to develop shingles, I might get it here, but it would not be here. So it's a rash that's usually on just one side of the midline of the body. It is vaccine preventable. We now give 2 vaccines for chickenpox to children. They have to be given at least a month apart and after the age of 1. So sometimes people will get their vaccines before their age of 1 for things like measles, mumps, and rubella, and chickenpox. And what happens with that is they don't have the immune system to pick it up and to recognize it later on in life. So sometimes they'll go to the doctor when they're 2 or 3, and the doctor will say, oh, we have to get another chickenpox. Actually, it's usually caught more often when they're trying to enter kindergarten. And that's usually when it's like, oh, you didn't have enough of your first dose was given too early, is usually what happens. So there are timetables for when to get your vaccines. If some of you are like me, you probably had all the childhood vaccines yourself as a child, and then when you got to school, they developed all the new ones and you got them, and then if you're a nurse, you keep getting them throughout your life. I no longer have any needle fear. The bacteria that causes impetigo is found in the fluid, and the lesions that can be found on the skin and the surface come in contact with these lesions. It is treatable with antibiotics. Often you'll see like a red, moist rash, usually around mucous membranes that spreads, and it can be impetigo. So if anytime you get something like that that's not healing with normal soap and water care, you want to think about getting them to see the doctor and getting in to see, could this be impetigo? And conjunctivitis is known as pink eye. We used to exclude people from school for that. We don't any longer, because much of conjunctivitis is caused by viruses. Viruses usually run their own course, and so just good care, unless somebody is hand to mouth and their hands are in it, and the drainage from their eyes is really bad, and in that case then I would exclude them from a program if you happen to be working in a program or something, just because they are more contagious in those ways, especially since babies live hand to mouth, and so do some of our people that we're taking care of. You know, they taste things, or you know, if you think of a baby when they're first born, what's the first thing they put in their mouth usually? Their hand, and pretty soon it's their feet, you know, and then it's anything. They try to lick grandma and everybody else who holds them, and that's just, you know, who they are. And some of our people with, especially those that have developmental needs, different might still be in that level of development where they are mouthing a lot of things. So you want to be thinking about keeping those clean. I gave you some sheets about that, and we'll talk about that this afternoon after break. And lice is something that, and scabies are parasites, and they're not a disease. So sometimes you'll run into lice. I get a lot of phone calls during the school year about lice. and it is distressing for people, and so are bed bugs for that matter. And it doesn't matter your level or station in life, it all happens to be just a normal process of what can happen. And really it's just a matter of using the correct shampoos and body soaps that you need to use to help do it. Wash the laundry around the person in hot soapy water. Make sure you use a nice hot dryer on those things if they can handle it. If they can't, you bag up your stuffed animals and things for 30 days. You can put it in the freezer for 3 days and that can help with it too. But vacuuming the surface helps. But really it is just about making sure any personal care items are not shared, and that things like brushes and combs are personal items that are not shared. If for some reason they do get shared, make sure you wash them. You can put them in the dishwasher. You know, I'm not sure wash them with my pots and pans, but you could go in by themselves if you're not sure your water is hot enough. That's one good way to get the sanitation. The washing machine would work too, but the problem with that is it has too much agitation and might break things. So that's why the dishwasher is a good solution for that. Airborne. How many of you caught norovirus ever? It's a stomach and headache, and usually it's about a 24 to 48 hour bug that causes you to vomit and have diarrhea really bad. Someone with norovirus in this room, if they stood over here at the doorway and they sneezed, we'd all be exposed. That's how contagious it is. And the same with the flu. How was your flu this year? Did you get it? Good. And getting the flu shot helped, and this year it was not a very good match, but I believe the flu shot does help as far as it boosts your immune system anyway. So it helps get you over the hump for some things. So I know that when I get the flu shot, I often am much healthier throughout the year. Even if I do catch the flu, it is not as bad as if I did not get the flu shot. So airborne transmission occurs when someone coughs, sneezes, or by blowing your nose. And it can occur when an infected person speaks, when you blow your nose, cough, sneeze, or speak, and the infected droplets exit those areas of your body and they spray quite far. In a little bit I'll show you a video and you can see some of the impact that happens when somebody sneezes. The measles virus is an airborne virus. So have you noticed an uptick in reports of the measles and mumps too, for that matter? Part of it is people do not vaccinate their children because they believe in something called herd immunity. Have you heard of herd immunity? And there are people who cannot get vaccines. And so in Colorado, we have 3 kinds of medical and religious and personal exemptions that people can choose for their children for vaccines and as an adult. Some vaccines do cause people to have fevers, or they're allergic to some of the substances and they cannot have the vaccine, or their immune system is not strong enough to be vaccinated. So that's why like a medical exemption might be part of it. Some people's religious and faith beliefs are such that they cannot take a vaccine. And then there are people who have personal beliefs in basically either the timing of the vaccine or they believe in herd immunity or different reasons. Not every state has a personal exemption. Colorado is one that does. So we are seeing more measles viruses, and people go, well, it's just the measles. And if you lived through the measles as a kid, yeah, you were miserable for 3 days or 5 days or 7 days, depending on which one you had. But it does kill people too, because the people who can't get the vaccination, their immune system is not as strong, and so they often will get the illness and be much sicker with it than what you might remember being sick with as a child yourself. Pertussis, whooping cough, is another illness that is spread through airborne disease. In Colorado, we are at an epidemic portion of pertussis or whooping cough, and we have been for about 10 years. Part of it is the lack of vaccination. The other part of it is they realized too that people who were vaccinated, the vaccine did not last as long as they thought that it would. It was not a lifetime vaccine. So now people going into the 6th grade get something called the TDAP shot. And that shot is very good to help prevent whooping cough. I work in a middle school during the school year, and we had quite a few cases of whooping cough about 5 years ago. I have not seen it as much. The TDAP shot came available, I think, about 11 years ago or 12 years ago, and since then I don't see as much of it with the kids. I do see it sometimes with the teachers. If you are a new grandma to be or grandpa to be, or an auntie, and you want to hold a new baby, especially during the flu and cold season, the the new mother's obstetrician or pediatrician for the baby might recommend that you get a TDAP shot, just to make sure, because babies do not get vaccinated fully through their for their polio and their pertussis and their tetanus shots until they are 2 years old. So they usually will require or ask you to get a TDAP shot. If you didn't get one in your adult years, it's a really helpful one to have. Have it during your adult years. The next time you need your tetanus shot, instead of just a tetanus shot, you can get a TDAP shot. The fecal oral route. One of your least favorite modes of transmission to even be thinking about. It occurs when you touch something that the infected person touched that was contaminated with stool, and they put their hand to their mouth, or you put your hand to your mouth. And if you don't wash your hands well after changing diapers or briefs on people, then you put your hands to your mouth, you run a huge risk of becoming sick. Norovirus is a highly contagious virus. This is one that's both fecal, oral, and airborne, and anyone can get infected with a norovirus and get sick. Also, you can get a norovirus with many times in your life, because there are many different types of noroviruses. So if you hear about those cruise ships sometimes in the wintertime that they have to keep people on the cruise ship for a little while longer after they dock to make sure everybody's getting over it. Cruise ships are a little different than like this building, for example, because we have the ability to bring in fresh air. We can wash things down, but a cruise ship, when you think about it, is carrying the water for everybody in a huge tank, so they need to be able to sanitize everything and disinfect everything. Where in a building, washing down walls and things for norovirus does not do much to reduce the spread of norovirus, but it does make people feel better, and your building does get clean. But that's something you want to think about. As far as just good hand washing whenever you are around other people, not sharing glasses with people. When you're in a buffet line, if you've noticed, they always want you to pick up a fresh plate. They don't want you to take the same cup, and sometimes it feels wasteful if you're at one of those buffet places and you got to keep putting your cup down in, but it does help reduce the spread of infection. The hepatitis A virus is spread through the oral fecal route, and it's not spread through blood. It appears as an acute, newly occurring infection and does not become chronic, most often through contaminated water and food. Some infected people may not have symptoms, and they usually improve without treatment. A number of years ago, you might hear in the nightly news that XYZ restaurant had an outbreak of hepatitis A because one of their workers happened to have it, and they didn't wash their hands very well after going to the restroom, and then they made your meal. So some of the common symptoms of hepatitis A are nausea, vomiting, a yellow tinge to your skin, and your eyes can become yellow because your liver is inflamed and it's not processing the blood work very well anymore, so or the blood to clean it, and so it's leaving extra bilirubin in your body, and so your eyes get yellow and your skin gets yellow and itchy. Sometimes they will go ahead and give Gamamune for it, but lots of times it will just run its course. But it is vaccine preventable. It's a 2-shot vaccine. You can get it anytime in your lifespan, and if you travel, they often recommend it. Some people get it before they go on a trip to, a country overseas somewhere, and then they forget to get the second one. Just get the second one, and then you're protected from getting hepatitis A. So how do you control the spread of infectious disease? First, hand washing. Thank you. I love that. Someone in the back was showing me washing their hands. Yes, proper cleaning and sanitizing and disinfecting, and ventilation. It's really important to air out your rooms. Rooms like schools, hospitals, clinics oftentimes do not have a window we can open anymore. So then you have to respect the indoor air quality. So reduce your use of things like air sanitizers. They don't work very well anyway, I'll tell you. I mean, they work better if they're on the surface of where you suspect it is. It's pretty hard to sanitize the air. You like those essential oils that are put through like diffusers and things like that. They're really bad for people with asthma, and some of my teachers I've had to really tell them, don't burn the candle on your desk, even though Tommy gave it to you for Christmas and it smells really nice, please reserve that for home, because 10% of the population has asthma as well. And those kinds of smells, even though it's in this room, if this is a closed environment and does not have the ability to ventilate the rooms very well, a person person 4 rooms over can still be exposed to what you're burning in this room. So you want to be thinking about closed buildings, and there is a real possibility for something called indoor air pollution, and it is all the things we put into the air, so be mindful of that. You want to use personal protective equipment whenever possible. Encourage staff to stay home when they're ill. You know, if you're sick, see, maybe somebody else can take care of your loved one that you're caring for, and require immunizations for adults too. You want to be proactive, follow hand washing, cleaning, and ventilation guidelines. Get a regular health consultation. Don't forget to take care of yourself. You're taking care of other people, but you're important, maybe more important, because you've got to take care of somebody who needs your help. So please make sure you get your regular health checkups. Encourage the parents and staff to keep immunizations up to date. That's a little more for a child care center, but you can use that in your own home or in your own world as well. Look for signs of infectious disease, daily health check. That's for daycares that bring kids in, you know, and the child comes in and he says, I threw up last night. Well, in childcare, we say you can't be in childcare for 48 hours from the time you vomited last. So, and the same thing with diarrhea. And we have rules about temperatures greater than 100, they have to stay home. And those are some things you could use for yourself. And we talk to the parents, and you can talk to if the person you're taking care of is not your immediate family, maybe talk to the other care providers and find out how well are they, you know, today. Sometimes you just get used to people being sick and you kind of forget that, you know, gee, now they're running a fever and they're coughing. And maybe there's other things that we need to do to help contain at least the virus or the bacteria that's controlling this person and making them ill. And develop some health policies even around your house. These are the reportable illnesses that we have in Colorado and in the nation. Meningitis, hepatitis, salmonella, giardia, TB, varicella, and others. And we call it outbreak is if you have 2 kids that are sick with a respiratory illness, but now if you have 4 or 5 kids, that's an outbreak. So if it doubles what normal is. So if you're taking care of one person and, you know, they've got a bad cold or whatever, and maybe you've got 2 people you're taking care of, and that's the limit that you have, and both of them are sick, well, you have an outbreak, but it isn't necessarily reportable because maybe it is just what's going around too. But you can kind of look at that within your own environment of where you're working. And we require child cares to keep an illness log so we can keep track of what's going around. Not a bad idea to find out, you know, if you're taking care of little Miss Janie and Janie is, you know, sick, you know, how often is she sick with stomach stuff? Maybe there's something she's allergic to that's causing her, or maybe there's a virus or something or a germ that we can take care of. So on Monday, you have 3 children go home sick. As I said, this is a little bit more child care related, but it drives home the point just well. 1 with vomiting, 1 with a headache, and 1 with coughing and fever. On Wednesday, the same. Is that an outbreak for Monday?
Yeah.
Well, you have just 1 with vomiting, 1 with a headache, and 1 with coughing and fever. So it's not, okay? On Wednesday of the same week, you have 2 teachers calling sick and 4 children go home with vomiting. Is that an outbreak?
Yes.
That is. And that would be some things where we begin to look at, okay, who came to work or to school sick? And you get that. I mean, I know we have to get to work. I know that the parents of the children I take care of have to do the same thing as well. They want to make sure that they can get to their jobs. There's only so many sick times you can take in a year sometimes, and so we'll get kids who come to school that, you know, were quite ill over the weekend. They're magically better due to Tylenol, so at 11 o'clock in the morning all of a sudden their fever comes back because mom gave them some meds in the morning. And I don't blame them because I know that, you know, you've got to get your work done too, but that's how we spread illness. Why don't we always exclude for everything? Now, I've lived a couple places in my life. I grew up in Wisconsin, so that's where some of the funny pronunciation of words comes from. And then I moved to San Diego. And in San Diego, they have a lot of strep, as we do in Colorado. I didn't see strep throat so much in Wisconsin, colder weather. And so cold weather makes people stay away from one another, so you don't have as much hand-to-hand contact like strep is. So children and staff have already been exposed. So have you ever heard of Fifth's disease? It's a parvovirus or hand, foot, and mouth disease. You might have seen that before on little kids. But people with decreased immune systems can get those things as well. And so those are things that once you see the rash, once you see the sores, unless the person is unwell feeling. You know, they've got a fever and they just don't feel very good, or they're not eating very well or drinking very well. They can still be in groups, they can still come to school because they were infectious before they broke out with the rashes on those things. Fifth's disease affects, the reason why it's called fifth's is because it is the fifth most common illness in children. And they look like they've got a slapped face, like someone took it and slapped their cheeks, a very lacy rash. It's not very itchy or anything. And that rash can bloom every time they're in the sun for up to 6 months after they were originally ill. And that doesn't mean they're sick, although you want to think, gosh, what's wrong? And then that's what it is. Once we begin treatments for things like strep, lice, conjunctivitis, ringworm, impetigo, or parasites, once the initial medications have been given at least 24 hours, they can come back and be part of your programs and be able to work and rejoin their families too. Lice is something that as soon as they're shampooed, you don't have to wait 24 hours. You know, you can begin to take care of the other cleaning that you have to do. It's kind of a messy thing to clean up after because you got to wash everything. But once the person has been treated, usually if a louse falls off your head and onto the floor, you're not going to pick it up and get it again. But our National Association of School Nurses convention I went to last summer, they talked about how they are looking at changing some of the guidelines for cleaning after a lice infestation has happened in a school or something, because they're realizing that, you know, lice need blood to live. And so without your head, they don't live very long, and so a normal vacuum would probably be fine, but they're looking at new guidelines for that. Reasons to exclude. The child does not feel well enough to participate, or the person does not, in normal activities, then it's perfectly fine. Staff cannot care for the child without interfering with the care of other children. So that person or that child is too sick to be able to join in with the other activities that are happening, so they're taking a drain on your staff. Or the illness is on the how sick is too sick document, and then I can give you a copy of that if you'd like that. How sick is too sick is if they have a fever, temperature greater than 100, they vomiting or diarrhea, they just don't feel well, or you know, they got the body aches really bad and they just aren't participating in what's going on. So we talked about all these lovely illnesses. How do we reduce your risk? We want to do good hand hygiene. That is the first paramount thing that anybody can do to help prevent the spread of illness. And we often think of all the other fancy things that you can buy, but really just some soap and water is the best thing you can do. Use of personal protective equipment, such as a little pair of gloves. Safe handling of potentially contaminated materials, and we'll talk about that. Good respiratory hygiene and cough etiquette, and waste disposal. How do you wash your hands? If you want to wet hands with warm water, you want the water to be between 90 and 110. Here in Colorado, we have very dry air, so I would go closer to 90 than 110 for the water, because that warmer temperature of the water will dry out your hands. If your hands get cuts or cracks in them, they carry viruses and bacteria, even with good hand washing, so you want to be careful of that. You want to use liquid soap. Bar soap is not good unless it's your own personal piece of bar soap, but then it still carries the germs and bacteria from the last time you washed with it. So get a good bottle of liquid soap at the counter. Lather and wash for at least 20 seconds out of the water stream. So that means you turn your water on first, you get your paper towel ready. Paper towel is actually better than a Turkish towel or terry towel hanging by the sink, because you're really going to do that. If that towel has been used by more than one person, it's contaminated, and we don't think about that. We have lovely towels in our bathrooms, don't we, sometimes? Be sure to wash the areas between your fingers and nail beds and under fingernails and the back of your hands. So the parts that are missed are this part between your thumb and your first fingers. This gets missed a lot. Your wrists get missed a lot. And after lunch, we're going to have fun. I've got some Glow Germ, and you can see how well you wash your hands, and we'll have that as an activity. So when do you wash your hands? Upon arrival to work or re-entering the classroom in a situation like that, before handling food or feeding people, I won't say just children, after using the toilet or diaper changing, and make sure the person that you're helping change briefs or diapers for, you're getting their hands washed too. Often we don't think about that. We're thinking, well, I changed them, they didn't touch anything, but you don't know that. If you're using a public changing table or something like that, you want to make sure too that that surface gets wiped down after you've used it. Before, if you're not sure about who used it before you, it was not a bad idea either. After coughing, contact, and runny noses and vomit, after playing on the playground or other messy play, so things like Play-Doh, water bottle, water activity tables, bubbles, all those kinds of things. Best to have personal if you can, but sometimes you can't help it, so then just good hand washing. I don't want to turn you all into germaphobes either. When do you wash your hands? After handling pets or pet cages, before and after water play and sensory tables, whenever hands are visibly dirty, before and after providing first aid and medications, after cleaning and sanitizing objects, after removing your gloves, before going home. I always tell this to my teachers, and I'll tell this to you too. If you're working outside of your own home, when you come home, you're bringing home everything from that place. So there are people who take their shoes off when they come home, and I've seen that work pretty well for most families, but you've got to be very strict about it. That means you can't let the kid walk out onto the driveway in their socks, because now they bring in the outside in too. So think about your shoes. Where do they walk? I mean, in just general life. You walk from your house, you go through the grocery, maybe you go other places. You know, if you work out in a gym, you know, your shoes are everywhere. You can wipe the bottoms of your shoes off with a Lysol wipe or something like that if you wanted to as well. But the very best thing is to make sure that you clean your hands. If you're around somebody who's got a respiratory illness, or they're coughing and sneezing, you're doing a lot of hugging and holding of people, change your shirt too. You'll keep your family healthier. Hand washing versus hand sanitizer. The use of running soap and water, running water and soap, and paper towels is the best method of hand hygiene. When you're using Purell or any of those kinds of name brand or non-name brand alcohol-based sanitizers, one thing, they're very drying for your skin, even if they say they have emollients. The second thing is they don't work very well if there's any visible dirt. So if there's visible dirt on your hands, you got to use soap and water. Some people use baby wipes or other kinds of hand sanitizing wipes. They're good until you can get to soap and water, but soap and water is still the gold standard for making sure your hands are clean. And then if you're around people who like to live hand to mouth still pretty much, be careful about hand sanitizer, because it does have alcohol. Most of them have alcohol in them. You can buy non-alcohol based hand sanitizer, which is better and safer, because I have had kids accidentally drink it or purposely drink it, and they do get blood alcohol poisoning with it, and they end up in the hospital. So you want to be careful about hand sanitizer. Even when you go to your doctor's office or something, you see them use that hand foam when they're in and out. A lot of that is now non-alcohol based, because we have had kids doing that. Wearing protective equipment, you want to wear gloves only once. CPR masks. If you have an AED at home or anywhere in the public thing, we have an AED out here, there should be a CPR mask to do respirations with when you're doing CPR. Are you trained in CPR? If, you know, you maybe renew that every couple of years. A CPR mask will help get you off the face of somebody, so it gives you a little more space, and they're inexpensive. I think they're anywhere between $10 and $20, and some of them are reusable. You just buy a little filter to replace if you had to use them again. Hopefully you wouldn't have to use that very often. And then aprons and smocks when you are doing things like wiping off counters and things like that. That just helps keep your clothing clean. When we're removing things like gloves, I will show you this, and then we'll practice this again this afternoon with everybody. So you wear your gloves. I've washed my hands before this. And I've done whatever I needed to do that required me to wear gloves. Now these gloves are contaminated, right? So I'm not going to be touching myself or my hands or anything like that afterwards. I'm going to take these off. What I want to do is pinch here at the wrist, and I want to take it down over the fingers and ball it up in the other hand like this, so it's in the middle of your palm. If you don't have a big enough hand, or if your coordination is lacking, it's okay to just dump that one away. There's no magic in holding it in the palm of your hand. Then you want to get underneath the cuff of this glove with your other hand, and then hold your hand away from you and just pull the hand that has the glove on back towards you, kind of like you're going to shoot an arrow, and then you've got it all in one hand, one little handy pocket. All the dirty stuff is on the inside. Then you're going to go and wash your hands. And throw your gloves away. Don't rewash them. If you're doing personal care or hygiene, you need to get away from where you're taking care of the patient. So eating or drinking, you know, unless it's a meal. Personal hygiene, apply makeup, handling contact lenses. Please don't lick your contacts and put them back in your eyes. It's not a good thing. I see people doing that all the time. And don't use water, because water could have bacteria in it that is not, normally a problem for people that are using water for the right things, but if you get it into your eye, it could cause an infection in your eye as well. Staff must use gloves while changing diapers. I have 3 daughters, and I don't think I would wear gloves for my own kids, but so that's something that you can think if you're taking care of a daughter or a son of your own. That might be a little different thing, but it does make it a little cleaner. It makes you feel cleaner too while you're helping to change them. But we recommend wearing gloves. And you must wear gloves if you're disinfecting anything too, because whatever is on that surface, if you get it on your hands, now you could accidentally get it back into your mouth, and now you're going to get sick too. And it might not even be, if you're in a public place like these tables, we don't know who sat, not to make you germaphobes, we don't know who sat here last and what they ate. So if I'm wiping off tables, I will always wear gloves too, because I don't have any food allergies, but I work around kids who do, and someone had a peanut butter sandwich and I was wiping off the table with a bare hand, and maybe I went to get something else thinking my hands were clean, and I handed you maybe a bag of chips or something, maybe there's peanuts on that, and now I've processed that along, where wearing gloves just makes everything cleaner. Laundry. The biggest thing I can think of is a bloody nose in the schools, or a child who wets through their clothing. Wear gloves while handling the laundry and the clothing contaminated with blood especially. Any soiled items that you want to handle them as little as possible. Don't shake them out, including diapers. Just put them in a plastic bag. Alert whoever you're sending that dirty laundry home with that what's in that bag, so it doesn't stay in a backpack or a care bag for a week, because that can be pretty nasty too. You want to wash everything. If you're washing your own laundry, the temperature of the water should be 165 degrees, unless contaminated, and that includes contaminated sheets, staff clothing, and they're talking mostly about blood with this, but you can think of anything. 165 degrees would be hot enough to kill just about anything, but you might have a restrictor on your hot water tank so that nobody gets burned. 165 is a very hot water, so you've got to kind of modulate that for your families as well. Double bag any child's contaminated laundry and send it home for parents to clean. If you handle sharps, there's a sharp container. There are people who just use like a coffee can and they tape it all up and they throw it away properly. In a public setting, there are needle boxes, and you want to make sure you are using the right boxes to put away your needles and not just throwing them in the trash if you're out in public especially. Do not handle sharps with bare hands. Don't bend the object to bend off the needle and break it. Don't recap a needle. Do not remove a needle if it's like in something that is potentially infectious. So like if somehow it was on there, they don't want you to like pick it up with a bare hand. And you don't want to purposely break sharp objects either. So when you're trying to break, something in glass, make sure you're wearing at least gloves if you have to do like an ampule or something like that to kind of protect your skin. This is what we're going to watch. So, a spill control kit. Where is this kit located? Maybe you've got one at home. If you work in a nursing home or if you work in your own house, you want to think about what happens if someone vomits on the floor. How do you clean it up? Absorbent material for solid liquids. Kitty litter would work pretty well. A scoop and scraper, so a child's hand, little sand bucket and shovel would work as well. It just depends on how many episodes you might have. If you're taking care of one person, you probably don't need a whole kit. You've probably got things at home. You could use paper towels, throw them out, and that would work fine. Who's responsible for the cleanup? Well, it's probably you. In a school setting, we use janitors. We have environmental staff in hospitals. Classroom teachers sometimes are responsible. And we all fall under all the other when we're caring for our family. What's the correct way to clean up? Cleaning first. You always need to think cleaning, then do you disinfect or do you sanitize? And how are you going to get rid of the waste? To clean, you want to wear gloves, use paper towels to soak up the liquid, clean using soap, water, and rinse. And don't forget the rinse cycle. There can be a buildup of soap, which soap attracts dirt, so then you have more dirt on there and germs than you originally started with if you don't rinse it with some water. Sanitizing things, this just reduces the germs on inanimate surfaces. You're going to wear gloves. You're going to clean the area first with soap and water. Then, according to your manufacturer's directions, you're going to use something to sanitize. I gave you sheets from Tri-County Health that have how to use bleach as far as like for sanitizing. You would sanitize anything that's mouthed. You could use, your dishwasher does a great job of sanitizing. So, if you're putting like things that are mouthed, pacifiers, chewy sticks, trying to think some other things that our kids and people might use that are people very orally motivated. Anything you're going to use, you can use your dishwasher to sanitize. And disinfecting, you want to wear gloves, clean the area first with soap and water, use according to manufacturer's directions. A disinfectant can be as simple as a heavier concentration of bleach as outlined in the handouts I gave you, or you can use some other things. I often get the question about commercial wipes like Lysol, OxyClean, and all those kinds of wipes. They do the job usually if you use the method that's on the side of the can. Many people use a wipe until they don't use it correctly. You need to make sure that if you're using a commercial wipe, that you're wiping off the table with, maybe it might take 3 wipes to get a table like this clean, and it has to be wet for 2 minutes for it to work. So, and then you need to rinse it because that chemical that's on there is on the table now. So if you put your sandwich on the table and you go to take a bite of the sandwich, now you're having a nice bite of some sanitizer or disinfectant as well. So you want to think about that. So the next time you're at the mall and the lady's wiping off the tables in the cleaning course, of course I see the kids and taking my own children to the mall, they take their sandwich out of the wrapper and where do they put it? Right on the table. And you're like, no. Even at home I try to make sure that they're using plates, but I catch them all the time being kids. And maybe the people you're taking care of aren't thinking about these things, but these are some ways that you can help reduce the exposure to other illnesses very easily by just using the correct things to clean and disinfect and sanitize. Waste disposal. Well, most of us in the homes and in schools included don't have regulated waste control. The only thing we have that's regulated in the schools would be some needle containers because we have kids with diabetes. And so we would have a special company come pick that up. If you've ever worked in a hospital or nursing home, regulated trash cans are usually red lined, and they're very specific about what's going to be thrown away in there. Usually has to be contaminated with blood or other infectious material because you don't want to have that out there in the regular trash. Most homes and small businesses can use non-regulated control. Diapers, sanitary napkins, Band-Aids, discarded gloves. For diapers and sanitary napkins, they should be double bagged. Just 2 plastic bags are fine and thrown away. A used Band-Aid can go in just the regular trash, as can your gloves. What do you do if you're exposed? You have contact with blood or other potentially infectious material, for example. There's a splash in your eye or mouth, you got some poop in your eye, or pee in your eye, more importantly if you're taking care of little babies. Bites that break the skin. Puncture wounds by a sharp object, a needle, or maybe someone cut their glass. You dropped a glass and you got cut by it. The incident occurs while you're performing your job duties. Well, your OSHA facts would tell you too. You're always going to rinse or clean the wound first. Take care of yourself first. There will be paperwork to fill out. Get a hold of your supervisor. Tell them what happened. They may want you to go see the doctor that is assigned to them, or to go see your personal doctor and take care of the cost of that. Maybe they'll offer you a vaccine if they think that it's wise, if you don't have the right vaccination for that. And because it's on your job, this would be part of something that you would do within your scope of practice of work. So you make sure that your supervisor understands this, and tell them when it happens, not at the end of your shift, when it happens, okay? Because then if there's something we need to do right away, we want to make sure, I should say we, I'm not your supervisor, but if your supervisor has something that needs to be done right away by the agency you're working for, you want to make sure that is accomplished right away. What is not an exposure incident? So you come in contact with blood or other potentially infectious material, but you have intact skin. So you have no cuts or anything. I got a splash of blood when I was hanging a blood bag one time on my arm. I'm just going to wash it, right? Bites that don't break the skin. Maybe you happen to be wearing your jacket and little Jimmy excitedly came up to you and took a big hug, and then he opened his mouth and got a little bite out of your arm, but he didn't do anything more. You got your jacket. He didn't break the skin. touching a child's tooth with a small amount of blood on it. Kids lose their teeth, up through about the age of 10 or 11, and they'll come up, look what I found, or I pulled my tooth. That's not an exposure. Or being sneezed on without blood. So the person, it doesn't have a bloody nose, but they sneezed on you. That isn't necessarily an exposure incident to worry about. But if you do get exposed, immediately wash the area with soap and water. Flush the splashes to your nose, mouth, or skin with water. Irrigate your eyes with clean water, saline if they have it, or sterile wash, and protect others. There's not really a magic with saline, except for it feels a little better than using tap water. So if you have it, it doesn't sting as much as water might sting your eyes a little bit when you're first getting it in there. Promptly report to your supervisor and document what happened. You'll receive medical evaluation at no cost to employee, includes healthcare provider's written opinion and your confidentiality. A hepatitis B vaccine. Agency should offer a hepatitis B vaccine to employee immediately, no later than 24 hours following an event in which blood or body fluids are visible, and it's a 3-shot series. If you haven't had this shot series, like I said, it came out in '89. Most everybody who's gone through the schools have had the opportunity to have it from 1989 and on. If you work in healthcare, it's probably been offered to you, and you might have decided to have it, or maybe there's a reason why you can't have it. If you refuse the hepatitis B vaccine series, then the employee signs a form declining the vaccine, and the employee may later request to have the vaccine. So maybe you didn't want it because you shook up about getting bit or whatever happened, and then you get home and you think, well, maybe I do want that. You always have the right to go back and get that shot series. A written exposure plan is something that on these forms today you're getting a certificate from us. You will sign the top part as your name, and near the bottom here it says, I reviewed the program's exposure control plan with this participant. If you're working in childcare or someplace that this certificate would work well for you, you can have your supervisor that you're working with sign that with you and go over what to do. What an exposure control plan is, it basically outlines exactly what are you going to do if you did get exposed. And this is what our agency does, so that you know what to expect ahead of time. So we help protect you in the workplace from exposure to bloodborne pathogens, reducing your risk to with accidental exposures, and you only want to work if you practice this properly at all times. And the place that you're working for has standard precautions up and running. I can't think of any place that with licensing that wouldn't, but you want to make sure that everything is available to you. If they don't have gloves in your size, ask for gloves in your size. Don't be trying to wear something too small, because it won't protect you well enough, and you won't be comfortable wearing them. So then you'll think, oh, this is just a quick spill, I'll just not wear gloves and wipe it up. So you put these nice fake germs all over your hands called glow germ. And I have a black light here, which probably will work better static than it will be picking it up. So right now you should have pretty good coverage, and I can see even in the areas where your hands are kind of dry, you're going to have a little more of that. And then we're going to excuse ourselves to the restroom, and we're going to wash our hands. We're going to turn the water on. You're going to have your paper towel ready and some soap. You want about a dime size of liquid soap on your hands. And then you want to get your hands wet first, then put your soap on. And then you want to rub your hands around, get the palms really good, get in between the fingers, get in between the thumb and the first finger, and I usually just use my thumb to do that, then I don't forget, and then do it on the inside too, because you kind of forget, and then do the backs of your hands. If you have nail polish, this is a good time to see how well it is put on, because you will see this stick underneath it. So it's really important that if you're wearing nail polish during patient care, that it is a fresh coat, that there are no chips on it, because bacteria, just like this fake bacteria, will get underneath your nails and then get around your wrists, because that's another place that we don't think about. Now, if you're doing, like a whole bed bath on somebody, you might go a little higher up with your hand washing afterwards, depending on how it gets wet, but this is the basic hand washing. This should take 20 seconds before you go to rinse it off, and long enough to think the song Happy Birthday or Twinkle Twinkle Little Star. So, as you come forward to go to the restroom, you can just go wash your hands. On the way out, if you want to put your hand in front of the glow light just to kind of see what it looks like now, and then go do your very best duty of washing your hands and come back, and we're going to check everybody's hands. Okay?
Okay.